I work for a large, not-for-profit integrated healthcare system called Sharp Healthcare. We're a regional system in San Diego, California. We have 7 hospitals, 3,000 physicians, 15,000 employees. And you and I, this is the analogy I make, you and I are passengers on a train wreck in slow motion. You and I are on a train wreck in slow motion. It's called our healthcare delivery system. And we all, whether we're consumers or providers or both, we're all in the same train, okay? So I'm going to offer you some hope today. I'm very hopeful that the reform and the change that we're going to have to inevitably make, I'm hopeful that we will make it. But of great concern are the people who are trying to deliver that service to us, healthcare professionals. Many of you are professionals in that sense. And as John was mentioning this morning, maybe healthcare should be those holding hands that catch people in the healthcare system. Well, what about the people who are trying to catch those people? That's what we're about. So I run the employee assistance program for Sharp Healthcare. So we hear the stories. We hear firsthand from the physicians, the nurses, the administrators who are struggling to provide care to you and me, and the toll that that takes. Because if you think about it, delivering health care is meeting suffering at every moment. That's what it's about. Some preventive care means we go in and we're okay and we get the good word, but mostly we're coming in because we're suffering. So the providers, the caretakers who live in that world have huge challenges. So I went off 2 years ago. I had the chutzpah to apply. I'm a social worker. I applied at the Stanford School of Medicine to the Center for Compassion, Altruism, Research, and Education, and I was accepted. And boy, was I shocked. Matter of fact, the first day I went, I thought there'd be 200 people, 500 people in the room being trained, and there were 8 chairs. Thupten Jinpa, who John mentioned this morning, who really developed compassion cultivation training, and Dr. James Doty, who is the director for CCARE, they were sitting there. We were the first 8 of the teachers that were going to go out in the field. We weren't researchers, we were not scientists, we're hands-on social workers, educators, and we went out to pilot this thing called compassion cultivation training. So CCARE, it was the vision of the Dalai Lama who founded CCARE with James Doty, Dr. Doty, and many others. Chade Meng Tan, who is the Jolly Good Fellow at Google, is one of our co-founders. The Dalai Lama's vision was that the cultivation of compassion is no longer a luxury, but a necessity if our species is to survive. If we're going to even survive on this planet, we have got to find a way to develop compassion. It's absolutely true in healthcare as well. Okay? Couple quick statistics. There's the first comprehensive study of physicians was just published in JAMA back in October. And what they found of the 7,000 physicians they studied or polled, 46% show at least one symptom of burnout. And the other thing that the study showed was that those in the highest risk clinical situations are more at risk for burnout than any other working class in America, any other profession. The other study that came out was that it's estimated that 1/3 of all nurses who are in critical care settings are either showing signs of what they call compassion fatigue, and I would maintain there's no such thing as compassion fatigue, it's empathy fatigue. If you really have compassion, you don't get fatigue. But that they are really at risk for burnout. So what we piloted at Sharp and is being piloted in a number of different areas, was compassion cultivation training developed at CCARE, again, by Thupten Jinpa. What Jinpa and the researchers and senior teachers like Emiliana and other people developed this secular model for teaching compassion, pulled out of, based on the historical model. It comes from Tibetan Buddhism, but it is a secular model that anybody can practice. And it's based on the historical model, but we are using the psychology, the science, the neuroscience particularly, and the social science that gives us as 21st century citizens a way to understand compassion and where it fits in a new way. So what the class consists of is it's 9 weekly 2-hour sessions. There's lectures, guided meditations, group discussions, the daily practice of the meditation, the recorded meditations in the teacher's voice, which I tried to get out of that, but Stanford convinced me that it was really important to have the teacher's own voice. And then we're doing a monthly follow-up class. And what we did is we opened this up to any of the employees at Sharp Healthcare, so that's doctors, nurses, administrators, housekeepers, anybody. And we also opened it up to some select community members so we could have voices, different voices. Okay. So as an overview, just real briefly of what CCT, Compassion Cultivation Training, is all about. It is a 6-step process in those 9 weeks. We move from the settling of the mind, and there's a debate as to whether this settling of the mind is really the teaching of mindfulness. It's very brief, but yet it's interesting to note that there are people in my classes who at the end of the class, nurses, physicians, and other people, who tell me that they're very much aware that their focus and their concentration is improved. Particularly, they are seeing people in a way they've never seen them before. They are paying attention. And goodness knows we want our nurses and doctors to pay attention. That's for sure. We move to the loving kindness actually compassion for the loved one. And the purpose of the second step is to raise those feelings that are easily felt for somebody we love and to cultivate those. It can be a conscious practice to cultivate the positive feelings, the positive emotions. It changes the brains. Third, we move on to 2 weeks of self-compassion and loving kindness. And many people report this is the most powerful step of the whole practice. That what people discover about themselves in the way, as Kristen talked about, and we really base a lot of what we do in those 2 weeks on Kristen Neff's work. I even show her videos in my class. Then we move to embrace shared common humanity, because as you can see, we're moving from the loved one to ourself, out in the world to common humanity, and we move to the stranger, the difficult person, and bring the guided meditation, cultivating those feelings of compassion and loving kindness for those people, those sentient beings as we move out. And then we end at the very end with an instruction on active compassion practice, helping people look at how they're going to practice for the rest of their lives. Okay? So our strategy, very briefly, was to grow this organically. We could have tried to start at the top and bring it in as a program for the whole corporation. And I felt like what we should do is start small. If it really was important, people would talk about it and it would grow. And that's what exactly happened. It got out word of mouth. We now we're through our 3rd series of classes. We have huge waiting lists. The word went out. We did no publicity. We also have champions from some senior leaders in the corporation who now are really champions for the program and for the teaching of compassion. And if anything, the challenge we have now is to not move too quickly. I have a physician in my class right now who, what he told us last week was that he was going from room to room all morning long seeing patients. He walked into a room and a woman who just burst into tears and said that her mother had just died. What he reported was, and he talked about this in the context of the compassion that he was learning to get in touch with. He said everything became focused, everything dropped away. She was present. She was present and he was connected. And he said he went on from there to the other rooms for the rest of the afternoon, but he was less stressed, he was more focused, and he was more calm. He used that as an example of with compassion, it made everything easier in the way he was delivering medicine. So I want to leave you with two other stories that, this is the hopeful part. I was going to scare you at the beginning, I'm going to give you hope. One is we have a chaplain, 25 years of chaplain, burnout from death and dying in the emergency room, and taking compassion cultivation training. She reported that she was transformed. She postponed her retirement. She goes home energized. This is a woman who is going to continue to serve. And then there's an older physician who on 2 occasions before he took the class argued with me and said, there's no way we can take on the suffering. To bring on compassion for every patient over my long career, I would have burnt out. So I finally said to him after 2 times, don't take the class, okay? Don't take it. Well, of course, he took the class. And what happened was, about 4 weeks into the class, a nurse he works with called me up and said, what in the heck did you do to Dr. So-and-so? I said, what are you talking about? And she said, I went home last night and he was holding a patient's hand. And it scared me. This very same physician, who's my age actually, he's close to retirement, he now is talking about applying to teach compassion training, especially for physicians. So I leave you with the hope that this will not be the only thing that will save healthcare for us, but in helping healthcare providers find the humanity and the compassion, we may actually avert the train wreck. Thank you.